the registrars or the doctors that are now trying to specialize, they need skills, right? And the current department that I'm in the Health Sciences University, we are the only ones that offer this type of, that teach this skill in South Africa, right? So they're coming to learn because now they're wanting to operate on, let's say, an artery or a vein, but it's a skill. It's not something that I can just decide to do. Maybe some people are naturally inclined to do it, yes, but most people want to learn. And I think that's a good thing from a doctor's perspective. You don't want a doctor who's just figuring it out with you while you're on the operating table. So they come and they learn the skill in an environment where it's a lab, right? So we get to teach them step by step. This is what happens when you do this. If you hold this incorrectly, this is what happens. The physiology behind it, right? You can't just take an artery and just do, there's things you need to think of while you're working underneath a microscope, and also being comfortable underneath a microscope. So like I said, we cannot use humans to do that. And you also can't use, there are some people that will practice on, let's say, a question that comes up, well, why don't they use cadavers, which is, you know.
I had that in mind, actually,
yeah,
when you're talking.
Yes. The point is that you need to check the patency of the artery or the vein.
What are cadavers for somebody watching, thinking, what are we talking about?
Dead body. Okay.
So cadavers are dead bodies that medical students use to do their practicals.
Yes.
And learn what basically you are doing with the rats.
Yes. So we can't do that. You need to check the patency. So when I say patency, I mean we're able to see that once I've sutured up my artery together, because remember we cut the artery in the vein, you have to suture it back again. But when you suture it back, it still needs to be open, which means blood still needs to flow. We cannot check that on a dead body because there's no blood that's flowing. So we need to check patency, because with that, we can pick up if the blood isn't flowing through the vein or the artery, then we can see, oh, you didn't suture properly, or you didn't align it properly, or you didn't put enough sutures, so it's bleeding too much. All those things you can only learn on a live animal. You cannot learn that on a dead body. So that's where we come in.
Ladies and gentlemen, thank you so much. I've got a very special lady here, Miss Naledi Mathole. Ma'am, thank you so much. Thank you for joining us. If you could briefly just introduce yourself and tell us about you, where you come from, where you studied, and how did you end up in the career that you are in. Over to you.
Okay, thank you so much, Dr. T. It's really great to be here. My name is Naledi. I am from the East Rand. I was based in the East Rand. I went to a high school called Nigel High School. I basically did your maths and science subjects. And I wish I had a platform like this, because I knew I wanted to go into science, but I wasn't really sure what I wanted to do. So then I finished my matric. And then it was kind of haphazard, you know, you didn't really apply the way that you should have. And then I decided, I said to my mom, no, I think I want to spend a year off and actually upgrade my marks, specifically in maths and science. I did that. And then when I had to apply once again, I was sort of undecided, but then I applied for clinical technology at Tshwane University of Technology, TUT. When everything was supposed to be sorted, I got there in January. They said to me, for some reason, my application, I don't know what happened to it, and it was just a bit of a mix-up. So they then advised me to say, look, there's some space in veterinary technology, because I think not a lot of people knew about it, and so there was some open space there. Can you please apply for that instead? And then because the modules are very similar, you can then jump over to clinical technology when you are, you spent a year in that. So that's how I initially got into veterinary technology. But it wasn't as easy. You apply, however, you have to get shortlisted to go write a test. After you write the test, you get shortlisted again to get an interview. after the interview, you get shortlisted for the actual course. So it wasn't like you just apply with your marks and then you get in. They really are strict when it comes to the people that have to do it. There was about an intake of, I think, 30 or 40 of us max in the entire class. So I did. And then the wonderful thing about what we do is that you spend, obviously, the first couple of years studying. The last year, you have to get an internship in order to graduate because you have to do a project in that field. So I guess the career prospects was really great. That's why I ended up staying in veterinary technology. I think it's the same for cleantech and medtech, I'm not sure, but I had a guy who was sort of like my mentor. So when I arrived in first year, he basically said to me, he advised me to say, you know, the nice thing about it is that you have to do an internship. So the system or the department will do everything it can to get you an internship. Once you're inside, then it's up to you as to how you perform. So I did that. And then you get your first, I would say, experience in interviewing, because now you have to apply. Obviously, at that time, I'd already worked. I was like I did something called Mainland just for extra money at Mainland Shopping Center, and I was also an assistant to one of the professors. But this was my first real, like, you know, job. So you have an advisor, WIL, I forgot what it stands for, but I remember she was the one that helps us. But they treat it like an actual interview. They put the post up there to say, final years, here are the posts. You need to apply like you would apply for a job interview. I applied, and then I went to 3 different interviews. I was blessed in the sense that I did get accepted for all 3. However, I initially chose one that allows you to rotate between the various departments, but genetics was such veterinary genetics was such a specialized thing that I'd never heard of it, and I really was interested in that. So I then landed up in veterinary genetics, and I worked there for a couple of years. I rotated between the normal genetic side, where we deal with parentage and all of that. I worked a bit in the forensic section. And then obviously, when you're done with your internship, if you've done a really good job, then they then say, okay, we're going to take you on. Or obviously, you'll be asked to leave. I don't know what they did with the others. But yes, we were then, the 3 of us that were at that department, we actually then stayed, all 3 of us. And basically, that's how I got into that.
Okay, so just to backtrack a bit, you did your matric, and then after matric, you applied for clinical technology, and then they advised you to go for the veterinary tech. Yeah. So why did you choose that particular field? Why clinical technology? What was it? What did you know to go to that particular field?
Well, what I knew about it was that, once again, it was looking at the career prospects. It just seemed like, in terms of getting a job, I did consider that. They seem to make it like it's one of those careers that there's a demand for it. When I looked up on it, there was a huge demand for clinical technologists, and they got to work a lot with the different disciplines, right? Similar to us, but they also, so neurosurgery, whatever, they got to work a lot in the hospital as well. I think they still do, if I'm not mistaken. So I thought to myself, I guess I can start there and then basically find my way up there. Remember, at that point, I wasn't really sure as well. I sort of had an idea of what I wanted to do, but not really. But that appealed to me at that sense. I knew I wanted to be in health sciences, but I wasn't really sure, what exactly I wanted to do.
So, but in your mind, what did you want to do? Ideally, when you're thinking about it, saying, let me go for this, what did you have in mind that you want to end up doing?
In my mind, I wanted to save lives. I guess that was why I wanted a field where I could do research. I had a huge interest in things that related to, let's say, cancer and finding,
I get you.
So my mind is based on, I want to be in research and I want to do things
medical research of some sort.
That's where my mind was, yeah.
Okay. And you did it with TUT?
Yes.
Which TUT?
Arcadia campus.
And how long was the duration of the study?
3 years, including your internship. However, mine ended up being 4 years, only because the first year I failed chemistry, so I had to redo it. Yeah, so chemistry, obviously it's like a prerequisite to biochemistry, so it blocked that and it kept me back.
Okay.
But I managed to finish. Yeah.
Okay. And then you said your internship, you did it where? At Main Lane or
No.
somewhere?
Main Lane, that was just the part-time that I did to make extra money. I did it at Veterinary Genetics Laboratory. That's in UP.
Okay.
At Onderstepoort. So that's why I did it.
So how did you get to know about the opportunities for internship at UP?
So the school provides us with all these places that are looking for interns, basically, because they know that we obviously need to do our internships. So literally put it up on the board to say all the final years, here's the list of places that are looking for people, and then you apply just like you would apply for any job. So they don't place you. They just put it up. They hear the opportunities, you apply, and then basically, yeah. And like I said, there's so few of us, to be honest, that I think almost everyone got placed somewhere.
Okay. Yeah. And for somebody maybe who's doing their final year and maybe their institutes are not like where you were TUT, and they want to find out what options are there in terms of internship, what other places people can look into if they want internship?
What do you mean?
Like if people are looking for internship opportunities, where can they look into? Are there companies that you can think of that you can share that they must check them out in case they are looking for something?
Yeah, so okay, so UP, that's Onderstepoort. It's the largest one because it's the only veterinary basically campus, right? So all these different departments you'll find at UP. So there's a lot of different departments there. That's the biggest one. Then you have your IDEX laboratories. You have ARC, which is the Agriculture Research Council. That's opposite the road. Some people went to provincial laboratories that need a veterinary technologist. So other people went to provincial laboratories in Eastern Cape. You know, I don't know the exact name, but I know they're provincial laboratories. And then any veterinary related laboratory, yeah, those are the ones that I can think of on the top of my head.
And what would you say the course entail when you are doing it? What are the core modules or contents that you focus on? And also the lab focus work? What do you actually do on daily basis or yearly basis that you think is the core of the course?
Sure. We do so much. I can't really say there's a core because we do the same modules as clinic techs, like I mentioned, and the medical technologists. So literally in one semester, you can do hematology, immunology, and...
What is that? Those terms are very nice. They sound very... So somebody at Kovimba.
Okay, so first year they do the basics, right? So it's your chemistry, it's your physics, it's your physiology. Okay, that's basic stuff. I think everyone maybe might know what that statistics. That's your first year. That's what you do. Second year now you sort of start to get into the nitty-gritty of the other things. So you do hematology, which is blood, right? You need to understand obviously how the different properties of it, how it relates to, let's say, virology. Virology is the study of viruses, because obviously there are viruses that are specific to animals. So you would learn that. Learn parasitology, which is then, you know, parasites that specifically affect animals. And sometimes you will then dip into the human side, because remember, some diseases will affect animals, which in turn affects humans, because if there's an outbreak of some sort, that would then affect humans. So there's so many, hence I'm saying, like, every semester it's quite an intense course. I always say to people, I know people think, you know, TUT, it's a very intense.
So do you have to work with live animals?
No.
Not at all. Okay.
Not with live animals. We work with samples. So the practical side of it, let's say you're doing hematology, which is blood. You will then, in the practicals, you will then work with blood to see how you process it in the lab. right? So because it's a technicon, they are very strict on the practical side, right? So yeah, so in the same thing with other, other sections, if I call it like that. So if it's parasitology or it's virology, for instance, if I can make an example, let's say you're doing microbiology, and now you have to do the different types of microorganisms and to see how they interact in different environments. So then you would obviously have the different plates that consist of different compounds, and then you would then see, okay, Staphylococcus, how does it interact in these environments, right? How do I isolate it under the microscope? How can I identify it, right? How do I know that out of all these 5 organisms, this one is a Staphylococcus or whatever it is? So like I said, for me, that was interesting. I love the fact that it had a lot to do with us seeing and not just reading up on something and then not understanding what it is. So that's also a prime example of one of the things that we did.
Okay.
Oh, yeah.
So yeah, because I'm very much interested. So when a person does it, I want to just wrap my mind around it. So what kind of interest would you say one should have to be able to enjoy this particular career field?
I would say you obviously, first of all, you need to enjoy routine. It is very routine work because once you're in, let's say, microbiology, right, which I absolutely loved, right? Microbiology, you'll be doing the same thing almost every day, right? You'll be streaking on that plate and it's the same thing over and over. So it's more of a personality thing, I would say. You need to be able to be a person who enjoys routine work. And I would also say you need to be a person who enjoys anything that's related to research. You need to be a person who's fascinated with finding things. That's if you want to take your career further, right? But in general, I think you need to be a person who doesn't mind routine. And yes, learning about different things, about how this interacts with this. But in order for you to take your career further, you need to be very proactive. And you need to be able to want to be fascinated about what your field can do in other aspects, if that makes sense.
Do you have to enjoy working with animals?
No, because you never work with animals. So it's you in the lab. That's what you're doing day in, day out. That's what I'm saying. You need to be a person who enjoys routine, protocols, because you'll be doing the same thing over and over again. You'll be running the same tests. Yeah.
Okay. And you spoke about now when you finish, you had to do internship. So if somebody were to do it and they are thinking about the internship, do you get paid to do the internship?
Yes.
And what can somebody expect when they're doing internship to be paid?
Okay, so it varies according to the fields that you're going into. So there are fields that pay more than others. Okay. I've heard of some people, I think the lowest people are getting 2,000 Rand per month. Yeah, I mean, it's a stipend. They're just thinking you need to get to work and come back, right?
Yes.
I would say my field, we were one of the, I would say, higher ones. If I remember correctly, we were getting around 4,000 Rand, which was almost double, 4,000, 4,500, I can't remember, but it was somewhere there. So yeah, so you won't get like a full salary, like, but because the expectation
that is generally what one will get in government, because I think they're just giving you a stipend to get to work, and they're actually providing you with experience. They're not providing you with something that can change your life. They're just actually just giving you experience. While they're giving it to you, they make sure that you don't struggle to come to work. You can be able to pay for transportation and eat, and that's all that. And when you finish now, you have done your internship and then you have done your qualification. What are the prospects of getting a job? Are they good? What will you say about that?
Back then, I don't know now, but I would say back then they were quite good because most of us got absorbed if you worked really hard in your department, wherever you were placed. Most of us got absorbed. There were few people there and there that perhaps didn't get a job, and they then had to look for other places. But I think then it also depends on how you performed academically. I will say that, yes, at the end of the day, yes, we're all interns, but if you performed quite well, I think maybe they feel like they're confident in you. And it also depends, like I said, on how much you work. What we were told is that when you get there, as much as you're getting into a department and it's new, you must find something that if they think of losing you, they would rather keep you on, right? So so that's basically you determine whether they keep you on or not. But I would say they were quite good. I don't know now, but definitely I know that they were good for us back then.
And do you need to, because I understand now you are advancing your studies. Is that related to job prospects or just your interest to advance in research knowledge, or why did you decide to pursue, and where are you now in terms of your studies and career path?
All right, so I obviously now I work in a health sciences university. So initially I thought, okay, let me go into lecturing or maybe more research related things. So I needed my master's. So I did it's a diploma, by the way. You do your diploma. And then I had to do my BTech. I had to further my studies. And then when now I wanted
you did that after your internship?
No, so you to even get a diploma, you need to complete your internship. You cannot even get a diploma without an internship. So once I had completed that and I was working, I then did my BTech part-time while I was working. And then after that, I obviously then decided to do my master's. And then the issue now becomes, if I approached other universities, because it's a BTech in veterinary technology, they were prone to want me in an animal science related master's degree or honors degree. So I then went back to TUT and I said to them, okay, I want to do this, but I'm in a health science related university. So what TUT is currently doing now, previously they had MTechs, right? But they've introduced a couple of years ago a master's straight in health sciences, which is what I opted to do because it looks better. Yes, I'm veterinary technology, but because I'm in a health sciences related field, it sort of merges together. So the idea was that I would then do that master's, which I'm currently doing now, a master's in health sciences, not an MTech in that. And then take that and either move further in, if I do decide to move further in public health, because I still do have a huge interest in those that type of field, then I could use that to basically bridge and get into that, because it's very difficult. That's another thing. If you're coming from a veterinary side, now you want to jump into a medical side, the first thing they ask you is like, but for me, it makes sense. We did similar modules with the other people, but for, I think on paper or what, yeah. They're gonna want to put you in the animal science side, which is not what I want to do for the rest of my life.
And what does your current job entail for somebody who might want to follow the same path that you followed?
Okay, so currently I am training postgrad doctors that are wanting to specialize in various fields like plastic and reconstructive surgery. I know people only associate them with cosmetic things, but they also do a lot of work where, let's say you've been in an accident, right? And they need to move a piece of tissue from one place to another, right? They need to connect veins or arteries together, basically to move, which we call a flap, right? In that case. Yeah, various people that need that microsurgical work. So basically it's surgery under a microscope. If I sum it up, anyone who needs to do surgery under a microscope, right? And might work with such small vessels. So in that instance, I came in because we work with rats, because we can't operate on humans. I mean, that's inhumane. We can't.
Rats as in like amakundwane.
Amakundwane.
Okay.
Catch them in the wild. It's not the ones you see under the fridge. No, they're called SPF rats, which is specific pathogen free. So they're bred in a lab somewhere, right?
Okay.
So they're bred in a lab, and there are those labs now. Also, just talking about your other question, where some of us vet techs will also branch into. So there are those labs that only deal with breeding animals for research purposes or other purposes, as it's teaching purposes. So anyway, we then buy the rats and then we then perform these procedures under the microscope. Then we show them procedures, and then they also, on the right.
Okay. I wanted to break it down a bit, just simplify it, because somebody might be watching and confused. Where does a specialist, a registrar, a doctor have to do with rats and plastic surgery? Just break it down and simplify it. Where does the rat and the doctor feature?
So basically, like I mentioned, the registrars or the doctors that are now trying to specialize, they need skills, right? And the current department that I'm in the Health Sciences University, we are the only ones that offer this that teach this skill in South Africa, right? So they're coming to learn because now they're wanting to operate on, let's say, an artery or a vein, but it's a skill. It's not something that I can just decide to do. Maybe some people are naturally inclined to do it, yes, but most people want to learn. And I think that's a good thing from a doctor's perspective. You don't want a doctor who's just figuring it out with you while you're on the operating table. So they come and they learn the skill in an environment where it's a lab, right? So we get to teach them step by step. This is what happens when you do this. If you hold this incorrectly, this is what happens. The physiology behind it, right? You can't just take an artery and just do, there's things you need to think of while you're working underneath the microscope, and also being comfortable underneath the microscope. So like I said, we cannot use humans to do that. And you also can't use, there are some people that will practice on, let's say, a question that comes up, well, why don't they use cadavers, which is,
I had that in mind actually.
Yeah,
when we're talking.
Yes. The point is that you need to check the patency of the artery or the vein.
What are cadavers for somebody watching thinking, what are we talking about?
Dead body. Okay.
So cadavers are dead bodies that medical students use to do their practicals.
Yes.
And learn what basically you are doing with the rats.
Yes. So we can't do that. You need to check the patency. So when I say patency, I mean you're able to see that once I've sutured up my artery together, because remember we cut the artery in the vein, you have to suture it back again. But when you suture it back, it still needs to be open, which means blood still needs to flow. We cannot check that on a dead body because there's no blood that's flowing. So we need to check patency, because with that, we can pick up if the blood isn't flowing through the vein or the artery, then we can see, oh, you didn't suture properly, or you didn't align it properly, or you didn't put enough sutures, so it's bleeding too much. All those things you can only learn on a live animal. You cannot learn that on a dead body. So that's where we come in. Usually we associate plastic surgeons with the cosmetic side, so the boobs, all of that, but they do more. They do reconstructive surgery. So in the case where a person has been involved in an accident and they basically need to move tissue basically from one place to another, right? That requires a form of microsurgery, because you're going to be connecting vessels together from one, So in that instance, then the plastic surgeons will then need that. That was also an eye-opener for me, because I also only assumed plastic surgeons are just there to make a person look pretty, but they do a lot of reconstructive work, life-changing work, which is absolutely phenomenal. So they need that skill as well in that aspect. And there's so many other specialties. Gynecologists also need this type of work, where they do an alternative to IVF that we don't know, right? IVF is the one that everyone knows when they try to conceive, but sometimes there are alternative ways, but that needs microsurgery. If you are also urology, right? You decide that you don't want kids anymore as a man, you get remarried. Now you have to do a reversal, right? That needs microsurgery. So I guess it's quite broad in what you can do with this type of skill.
What about other people who specialize in the same field, but in other institutes? How do they learn what you are doing?
So basically, you mean from as doctors, or?
Yeah.
Okay. So obviously, as a doctor, obviously you can graduate anywhere in South Africa, but the specific skill, right? It's only our institution that offers it in the entire South Africa. It used to be us and Stellenbosch, but Stellenbosch closed down their facility because of, I don't know what happened there, but Stellenbosch is no longer operating. So if you want this type of skill, remember, it's also an option, right? It's also a choice that a person has. I'm not sure about the plastic and reconstructive surgery. I think they have to come. But most people, let's say if I'm in urology, right? It's not really a must. It's me as a doctor being proactive and saying, I want to learn the skill in an environment that is conducive for me to learn, right? For someone who is actually there, because you're there for 2 weeks, that's a long time for someone to sit with you and make sure that you're doing things correctly. So yeah, you wouldn't, there is no other place where you can learn it. Like the skill specifically where someone is sitting with you for 2 weeks, no, we are literally the only ones in the entire South Africa that does it.
So the students that come to you in particular, are they specializing in which field, the doctors?
So, okay, so the ones we've had is, like I said, plastic and reconstructive surgery, ophthalmology. So ophthalmology, although they don't work with vessels like artery and vein, but they need the skill of handling the surgical instruments underneath the microscope. So that's what they need. And that's why they come. It's actually a lot of ophthalmologists that come or who are trying to get into posts, registrar posts into ophthalmology. And then you have mostly plastic and reconstructive surgery. And then you have orthopedics. Orthopedics is the bone. However, there are those who, after completing or who want to get into hand surgery, right? That's when they will then need more specifically the microsurgery. So they come. Because the nice thing about microsurgery is that we don't only teach, yes, about the connection of the vessels, but it's also about tissue handling, right? Because it's not just about getting to the bone, right? What makes a good surgeon is that you need to also understand how to navigate around the tissue. Like you mentioned, healing and things, right? You can't just be chopping through things just to get there. You need to be able to appreciate how to handle tissue in order to do what you do. So I would say that as well. So we've had that. We've had urology. We've had neurosurgery. We've had pediatric surgery. The vessels aren't that small, but it's something that they want to learn. And then we've had a few odd from there and there. Like I said, some of them, they're trying to change fields, right? So it works better also for career prospects. If I can say, I want to move from one surgical department to another, and I've obtained the skill in order to do so, if that makes sense.
But I'm just wondering, when we're talking, whether can somebody with a BSc zoology branch into it?
Well, I'm not sure, because the main reason they wanted a veterinary technologist is because just like medical technologists and other fields, they have registration, right? You cannot, from understanding, work with animals at the level that we're working with and not have someone who's under SAVC, which is my body, right? The South African Veterinary Council. So you need to have someone under SAVC because the animals, in a sense, need to be represented for as well, right? So that's why a veterinary. So I'm currently working with a medical technologist. There's 2 of us. So there's one who's a medical technologist who's coming in with his own registration body, and then there's me who's coming in with my veterinary registration body. So the both of us, then it's sort of like it's covered, because we also have to adhere to certain rules. It's not like we are just operating. There's ethical considerations. There's, all those things that we need to go through. And in order to meet that criteria, in order to have us operating, we do need to have certain people on board to be able to fulfill certain duties. So yeah.
And then how does a veterinary technologist relate with your normal vet?
Okay, so basically the vet is the person who works with animals. That's the first thing that separates us, right? They work with the actual animals, whereas we work with the samples. So you can say that the vet sends the veterinary technologist things to process in the lab to get results to send back, and then they can interpret it however they want, or whatever they need it for, right? So the veterinarian, for instance, when it comes to prescribing drugs, right, we need a veterinarian to sign off on the drug. As a veterinary technologist, I cannot sign off on, how can I put it, prescribing a drug. they can authorize me to use the drug, to do certain things with the drug once they've prescribed it, right? So that's basically another thing that basically separates a veterinarian with a veterinary technologist. You can say that a veterinarian has more signing power, I don't know what you call it, but what I'm trying to say is that there are some fields where a veterinarian cannot be present all the time. So they then will then give you the authorization to do certain activities. And even then, some places I've heard from former classmates, they just need to also go to SAVC and say, these duties otherwise would have been done by a veterinarian, but because of where we currently are, I need to get signed off on it, right? And then you get, I don't know what the procedure is, you get signed off that you can perform the same duties. But ultimately, you need to get some type of sign off to be able to fulfill those duties. Whereas a veterinarian, they don't need any permission, if you call it that. They just fulfill that role.
And then do you have a vet technologist who have their own lab, who do their own assessment privately?
Yes. So what we were told in first year, we actually did do a course. I forgot what the course was, but it was business related. And they actually said to us, once you are a veterinary technologist and let's say you have a degree or master's, whatever, you are able to open your own lab. You don't need to be a veterinarian to open up your own vet technology lab, if I call it like that. So there are people that have branched into that. Who have their own maybe labs or things like that. Obviously, money is a thing. You need to have the money to open up a lab because of the operational costs and so many other things. But it is possible for you to open up your own lab, yes.
Is it something that you're considering?
I have considered it, but it's something that I would need to know what exactly I want to specialize in or what specifically do I want to do in that lab. So I haven't really found anything. And like I said, the things that I have done so far are things that are very different from my field, to be honest. I've been blessed in a sense that, like I said, from veterinary genetics, I was already different. From now genetics into microsurgery, I'm already different. So I would then have to hire someone else with different expertise in, let's say, serology or in hematology, people that have at least done it for a couple of years, because my background, I moved away from all those things once I left TUT. I've literally been on a different path altogether. So yeah.
I'm very much fascinated and I've got a huge interest in it. And I think it has a lot of career prospect that one can look into. And I would have thought, and I'm glad that you brought the issue about they can actually have their own lab. And I think that's something that for me will look more lucrative if one can pursue it and be able to establish it. So it's very, very interesting. So let's say now somebody has completed that internship and is working as a medical, you call the career, you call it what? Veterinary technologist, yes. A person who qualified in the field. Mm-hmm. So if it's not internship, what could a person who's now fully qualified expect to get as a starter at work salary-wise?
Okay, as a starter after internship?
Yes.
Sure. Okay, so we got started around, it depends. I think our starting point was 12.
Okay.
12, 15. And like I said, it depends. It
depends where a person is placed. Yes, I get that.
So I would say around 12, 15 max starting.
Okay.
Yeah, I don't think you should, especially because you only have 1 year experience. So 12, 15
yes.
is going to most likely land. Yeah, but like I said, it's dependent. Some people get more, some people get less.
Okay. And you have been in the field now, and obviously you know a lot about the field. How long have you been in the field at this point? And will you, or what will you say to somebody still looking into it as a career path? How will you, what will you advise those people?
Okay. So yeah, so veterinary technology, in the recent skills development, I don't know what we call it, that document that came out. Technically, it's a scarce skill, right? It's regarded as a scarce skill in South Africa. However, the career prospects of it, you need to be a person who's very proactive in your career, okay? In terms of whether you want to grow in your organization or in terms of salary, you need to be very proactive. So what I would say to people is that do your research as to what exactly you want to do in veterinary technology. Because like I mentioned, you'll be doing the same thing over and over, unless you've got a plan to say, from here, I'm going to do this, and I'm going to do that, and I'm going to do that. I do know some veterinary technologists who have completed and are struggling to get a job. Yeah, it's I'm not sure, that's why I said now over the years what has happened. There are those that are struggling to get a job. However, when you get a job, and if you're looking at money-wise, you need to be very proactive in your career. You really need to move and study and do all these things, because there'll only be some opportunities that are open to those that have BTECs. Surprisingly, there'll be a job, say, if you don't have a BTEC, we won't take you. Same thing with masters. But what I say to people, don't now get a PhD in veterinary technology without knowing why, right? Because there are those people that I also know of who are overqualified. They are now sitting with PhDs in veterinary technology, but where are you gonna go? You know, you would rather be doing that while you are growing in whatever it is. Don't just study for the sake of, I want to study a PhD in this, and yeah.
No, thank you so much. I know I must release you, but any last words to those who might be watching and also looking at this video? Any words that you can just share with them before we close?
I would definitely say do your research, watch such YouTube channels. I definitely think that if I had such platforms where I could see what people actually do, and also shadow people. Don't be afraid to go to someone and say, whether it's inboxing them on LinkedIn. I'm doing that now that I'm older. I'm asking people, okay, I'm interested in this. What exactly do you do? You'll find a lot of people are interested. They will tell you, yes, this is what I do on a daily basis. This is the pros, these are the cons. And then you'll be shocked as to whether you feel like you are aligned to that. So be very proactive in finding out something before you commit to years and years of studying and you've paid and all of that. So yeah.
So, Franz, thank you so much. That is Ms. Mathole, the veterinary technologist. I hope I won't bite my tongue there. But thank you so much, ma'am. I think you've shared a lot, and I believe that those who are watching are going to learn a lot from this video. And I do encourage people to comment on this video, and if there are any questions, they share them with us so that they can be able to be informed about this particular career path. And I encourage those who are still studying it to really pursue it and go as further as they can with their studies so that they can also reach your level of studies. Any prospect to do PhD in the future?
Yeah, I like veterinary technology, but yes.
Okay. Naledi, thank you so much. I really appreciate your time, and I hope that we'll have a time to continue it again at some time. I feel like today we hurried it, but we need to have more time to go in depth into it. Thank you so much.
Thank you. Bye.